Is trying to do its best to protect our seniors, so they're releasing new guidelines for nursing homes across the country. Team 12's Matt Yurus joins us live now to tell us what some of these new protocols are. Good morning, Matt. What exactly are we seeing in terms of changes here?
Ryan, you said they're all meant to protect our loved ones who are the elderly, and there's one big change we'll get to in just a moment. I do want to flag before we go any further, as we've reported consistently, our senior citizens are among the most vulnerable to the coronavirus in our population, and really outside of an in-care patient setting, a hospital, the most recorded deaths from coronavirus by the CDC have come in our nursing homes or long-term facilities, care facilities, hence the big change. So what is it? Here you go. Take a look. Nursing homes are now required to inform residents, their families, and local leaders about any outbreaks. They're also required to report coronavirus cases directly to the CDC. This will help the CDC with contact tracing and help families make informed decisions for their loved ones. Before this, the CDC had not formally tracked the number of COVID-19 cases that spread inside homes. Here's a county doctor.
Know that these are the people who are most vulnerable to severe disease, and why we're really putting our efforts focusing on keeping them safe.
Data from the Maricopa County Department of Public Health shows 60 long-term care facilities in the county have at least one positive case of COVID-19, and more than half of the 75 people who have died in the county were residents of a long-term care facility. If you have a relative, a loved one in a long-term care facility, the county, the CDC recommends that you reach out directly to that center and check on your loved one and see what they are doing to keep them safe. Live in Phoenix, Matt Yurus, Today in AZ.